Welcome back to the Clinical Leadership Podcast. I'm your host, Dr. Alex Earl. I just finished up recording a short episode with Dr. Caleb Burgess, who is a physical therapist in Southern California, who you may or may not know from his large social media presence, especially on Instagram, where Dr. Caleb has currently over 634,000 followers on Instagram alone. But first, we have several live courses coming up in the near future here that I wanted to let you know about with Midwest Rehabilitation Institute. Do you struggle with exercise prescription, intensity, or dosage? If so, we are here to help. We have our Essentials of Clinical Rehabilitation course coming up on July 17th and 18th in Chicago, Illinois. If you struggle with taking a patient from day one of the consultation through a completed plan of care, we built this course with you in mind. This course is not for everyone though, so I wanted to warn you beforehand. There is no certification attached to the end of it. There is no internet guru teaching made up phrases or medical interventions. There is no do it my way buy-in required, and there's no system to memorize or master. This is simply a course from the trenches on nearly 6 years worth of treating patients in pain without the need for gimmicks, unethical sales tactics, or any nocebo-like communication, such as fear, shame, or guilt. This course is designed by rehab professionals for rehab professionals. If you'd like to enroll in the course, visit mwri.co. That's mwri.co. Please note it is not .com. And click on the courses tab at the top of the homepage to enroll. Now, let's dive into the episode with Dr. Caleb Burgess. Well, welcome to the podcast, Caleb. We are thrilled to meet with you today, virtually, of course. This is the Clinical Leadership Podcast, sponsored by Midwest Rehabilitation Institute. Caleb, welcome to the show.
Happy to be here.
Well, for those that don't know, I'm a 2011 graduate from the Azusa Pacific University. And that is actually where our paths first crossed. I played on the soccer team. You played on the basketball team. So I wanted to start off today with school and then go from there into social media because you've got quite a following and a presence. And in our opinion, a good presence, a positive presence online. And so we want to unpack that a little bit. But in regards to Azusa Pacific, how do you feel your time at APU prepared you for the real world?
It's funny you say that because some people might say as a small private Christian school that it didn't prepare them well. But for me, I came from an even smaller private high school in Orange County, California, and it was even more of a bubble. So actually to go to Azusa actually did help kind of broaden my horizons a little bit and did help prepare me. And I actually went, and you might already know this, but I went to physical therapy school at Azusa. So I actually stayed there. I was there for like 7 years. I had a really good time playing basketball, meeting my wife, and having a lot of good faculty to learn under as well, especially the whole thing, but in physical therapy as well. So I had a really good time.
Yeah, I really enjoyed the faculty in the applied exercise science department. Still, I remain close with several of them, texting, emailing frequently. But specifically in regards to the physical therapy department, I left. I graduated Azusa, like I said, in 2011. And then came back to the Chicagoland area and started chiropractic school about 6 months after graduation. And did you do something similar where pretty quickly after you graduated, you enrolled into the DPT program at APU?
Yeah, I took an extra semester to graduate because I declared my major late. And as you know, like it's tough getting all that stuff in while you're playing a sport. So I just was like, I took an extra semester, but the way that our school runs is they start in February. So I graduated in December, and then I took like a 2 month, like, let me just enjoy these 2 months off, and then boom, right into it from there in February.
Awesome. So what made you choose like physical therapy? All the sports injuries you had, I'm sure.
Yeah, I mean, I broke my elbow in high school. I tore my meniscus from my junior year going to senior year in college. So just going through and just having good experiences, and that's not really an original story. It's like everybody's story usually. They've gone through it and they really are like, man, I feel great having gone through this. Like, to have that job to help somebody come back from an injury it must be so rewarding. So, and I've always loved being an athlete and being active. So I was like, hey, this seems like a good career choice to do. And I got into it, and it's been a blast so far.
Well, speaking of the DPT program at Azusa, there's some fantastic faculty members there, specifically the ones that I know and have met over the years, which would be Claire Frank and also Kathy Kumagai, who I believe has recently passed away, which is just incredibly saddening news. But I actually met Kathy in Prague. It's funny, I had to go all the way to Prague in the Czech Republic to meet Kathy, and we were just chatting at one of the classes that we were both attending. And she just said, well, I'm on faculty at a physical therapy. It's a small school in Southern California. I was like, I went to a school, a small school. She's like, well, it's Azusa Pacific. I was like, I went there, so it was really, we had a nice moment that we had to go all the way to Prague to meet, even though we were probably just down the hall from each other for at least, several years. But because of her work within the DNS world and her relationship with Claire Frank, that's kind of how we stayed connected over the years. But it's really cool to see APU with some of the fellowship opportunities that they have for physical therapists. And then they can get plugged into, like it sounds like you've been plugged into a nice job in the Kaiser Permanente world, which is fantastic. Like that's solid for a school to be so well connected and so well respected. And it's our alma mater, so we got some pride there for sure.
Yes, sir. And you have a national championship under your belt, right?
Well, yeah, I do. Yeah, you're right. That was my
Yes.
freshman year. We were
Yes.
2007 NAI national champs. Thanks for that reminder. Yeah, I got a little.
Yes.
Yeah.
And
Small
just
brain.
some bittersweet here. So for you, you won. And then I don't know if you remember, but my junior year, we lost by 1 point in the national championship game. And we both could have been sitting here going, yeah, we both won one, but 1 point short for us.
I remember the girls basketball team and you guys both making it to the final. And I remember just being like, this would be amazing. And so the whole school was gutted when you guys fell short by that 1 point.
Yeah.
Just absolutely gutted.
I mean, it was a great experience, but man, I think about it now and it still brings back like a 5-minute moment of depression, and then I'm like, it's all good, life's still good.
Oh man, I can't imagine. Well, so when I was a junior and a senior in high school, the Azusa men's soccer team lost in the final both seasons. So then the third year, my freshman year, I walk in, I'm like, this is amazing. We just won the national championship. And the juniors that had just lost, the last 2 times, the seniors that were as well, they were like in tears, like just this is because they had just suffered, the depressive seasons before that of coming so close but falling short.
Like finally we did it. Yeah.
Yes. Yeah. It meant that much more to them. So, well, without this turning into just a straight up commercial for Azusa Pacific, which maybe we should share it with them and let them know that we're talking so highly about them. But I wanted to transition over to your current influential role online, and you've done an incredible job of building up a solid reputation online and also a solid following. I currently looked as of this morning, on Instagram, you have over 634,000 followers on Instagram. Let's unpack that a little bit. Was that your ultimate goal, was get as many followers as you could?
No, I mean, honestly, at the beginning, it was just like, I mean, I think a lot of us that do this stuff, we do like extra stuff outside of just helping people in our clinic or wherever we work. It's like we always want to do something else to help more people or do something more to stimulate our brains. So it was really just to I felt like, man, I gotta do something else. I gotta share what I know with more people, help more people if I can. And I don't know if this is going to grow into anything, but like as an athlete, like when you really get focused on what you like to do or what you love, you will put your all into it. So I thought, I'm going to do this. I'm not going to half-ass it, for lack of a better term. I'm just going to go and learn as much as I can about how to do this stuff. I knew nothing really about marketing or how to make things look cool or like eye-catching or stuff like that. But I'm like, hey, if I can learn as much as I can, maybe learn from some of the other pages that are doing some stuff on there because when I started a few years ago, I started like at the very end of 2017. And like there were a decent amount of pages, but it was still pretty early in the game as far as like doing the social media stuff. But so I think that kind of helped me a little bit for sure. But it's just something that I wanted to get out to as many people as I could. But I did not think it'd get anywhere near. I mean, I still remember like getting to like 10,000. I was like, I can't believe I'm at 10,000 followers. Like, this is insane. Like, how did this happen? And then now today it's like, whoa, it's like, it's incredible.
Well, kudos to you, man, for doing it the right way, because I see a lot of people that put out, like you said, kind of half-assing content, and that's a fear of mine. Is in my private practice, but then also with the education side is, you put yourself out there, you put videos of yourself, you put the content, you come up with it yourself, and you have a nice theme, and I'm sure that goes a long way with your followers, because that takes time, and people respect
Yeah.
how much time some of these pages. Because if you just half-ass it and put something up there, it's going to show, and time will tell via quality, who will stick around. And so kudos to you for putting things out the right way with the right message, and consistently. And I think a lot of people think they'll open up their own clinic. And so for our listeners, most of them are private practice owners, or they hope to open up their own private practice someday. And
Mhm.
marketers these days, they all say something similar, like you have to have a social media presence. And
Mhm.
so people just put up random things on their social media. I'm guilty of that, because if I have 3 minutes, I'll just put a post up that I find interesting. And so there's pros and cons to that. But
Yeah.
what you've done is you've consistently, that's a key word that I want our listeners to take home with them, is how consistently you post. So
Yes.
how do you have like goals that you set for yourself, or do you just think like, oh, this is the information, I want to get it out, or like how much strategy goes into what you put online?
So it's hard when you've been doing it for so long, you kind of forget how much strategy goes into it because it's like just like your normal, like every single day. So sometimes I feel like, man, I don't really have much of a strategy. And I know other people are a lot more organized than I am. I'm not the most organized person in the world. I kind of have ideas bounce all over the place all the time, but my managerial skills are pretty poor. But like my thought, like, oh, I want to do this, I want to do this, I want to do this. Like I can think of a lot of things. I try to write them down on my phone whenever I can. And I try to, at first it was more like taking all the experiences of like patterns I see in the clinic or things that I see very commonly with the patients that I work with and go, what are the things that I wish people knew? Or what are the things that I wish people knew to help themselves with specific exercises? Or rather than giving a bunch of random stuff, like what are the things that I really think would actually help people? And of course, like you got to individualize it with the person, but I'm like, if I can give something where I notice these patterns and I'm usually prescribing these exercises, like for example, like exercise posts, then I thought like, hey, if I put this stuff up and I do it in a good way, and especially in my early videos, I'd still do it, but not as nearly as much because it just takes so much time. I used to like really like in my videos have like arrows and like cues of every little tiny thing so that like I'm like, this is the stuff that I tell people in person that I'm always having to tell them to do an exercise correctly and with the best intent. How do I put that on there? And so I started doing that, and like I had that strategy of like, okay, I got to just get what I need people to know and what am I cueing them all the time. And then it takes time to get that growing, but it really helped. At this point, it's really just like off the cuff, like week to week. Like I try to plan out a few posts, but sometimes it's literally like the day of. I'm like, all right, what have I not posted about in a while? Okay, this thing. But I have such a library of exercises now, I can kind of pick and choose on different topics and stuff. And it does get more difficult the more you do it because like I don't know, over 1,000 something posts now, and it's like you get to a point where you go like you start to think, oh, man, what else can I post about? And sometimes you kind of have to say the same thing in a different way, um, and kind of repurpose it in a way. And sometimes you can repost, which is nice. The more posts that you have, the more that you can like choose one from 6 months ago and go just repost it, and the chance that people saw that or remember it is pretty low at that point. So that kind of helps as well. I know I'm kind of rambling here, but
No,
hopefully this is helpful for people
this
to.
is the type of information that like myself, like I'm learning from. But and so I know those of us in private practice, I think deep down we want a good social media presence, but we don't really know where to start. And so to hear
Yeah.
someone who just started and went after it like you did, and is still learning as he goes, is like actually quite reassuring to me that, all I got to do is start, and once I start,
Yeah.
keep it going and stay consistent with it. And like you said, you're going to run out of things to talk about. But I like what you said about what information do I have that's could help someone out there. And if you come from that
Yep.
genuine place of like, not to speak for you, but like why you became a physical therapist in the beginning is to help people,
Yeah.
then your message is going to come from that genuine point of view or that genuine perspective, because everyone can tell online, who's doing it for either the money or who's doing it
Mm.
for the likes or the follows. Like, just put a scantily clad woman on there, or a guy with his shirt off.
Yep.
You'll get followers. Like you will.
Oh
If
yeah.
that's what you want to do, you'll get followers.
Yep.
But again, I know I've said this multiple times. I like the way, and I greatly appreciate the way that your material is presented, because it is helpful. It's some of it's very basic for the lay people to understand.
Mhm.
Others of it a little bit more complicated for some more complex things. Like we're dealing with human beings, right? So um, the other thing I've really noticed on your feed is almost like your transformation on how you want to communicate the concepts of pain. Tell me a little
Mhm.
bit about your growth as a clinician in regards to the complex topic that pain is, and how can you communicate that on your platform?
I think the biggest transformation. So like going through schooling and then doing like a residency after finishing and then doing a fellowship afterwards, like we did get a lot of great information about like the complexity of pain and pain neuroscience and how to communicate this with patients and all that kind of stuff and the strategies. And I don't know if you're probably familiar with like the Explain Pain book and the work by like Adrian Lowe and all that kind of stuff, Greg Lehman, all that kind of stuff. So
Yep.
it's it's one of those things where it's like the information, but then it's also you still have to constantly practice. How do I get this information out in a way that is not overly complex? It makes people want to look at it and read about it, but at the same time, trying not to make the language either too complex for the pain side or like almost like nocebo language, where it's like you want somebody to be interested in it that has no idea what like they're no idea about pain or no idea about the complexities, like just the average person, but the same, and you want them to click on it. But at the same time, you don't want to be too clickbaity where you're actually making problems worse. Does that make sense? So it's
Yes.
like, if there's certain people, and I guess if you look at my post from like 2 or 3 years ago, and even sometimes people can argue now, but I try to always layer it with other things. Um, I used to maybe explain it in a way that if I read it now, I might be a little bit more like, ooh, like I don't really like how I worded that. That comes across like I'm labeling this thing as just a strictly like biomedical issue that's not really talking about the complexities of pain as much, even though I knew them. But I kind of felt like, people don't really want to know about that. That's just too complex. Whereas now I'm like, a lot of these people that are going on to look at the posts on social media, like the average person isn't going to go look at stuff. Like the people that are like looking at stuff have been looking at thing like a problem or a fix to solve their problem forever. They're looking at a bunch of different pages. They're constantly searching for things. So they actually know quite a bit about their issue usually. So to have somebody kind of explain things in a more holistic way, where it's like, hey, it might not just be about your meniscus tear. It may not just be about the disc bulge that you have, or maybe that's not even a contributing factor and things like that. And always trying to like layer this into like, hey, pain is multifaceted and things like that, and always trying to layer that in. And almost like, not that you're brainwashing people, but you're constantly teaching them that like, hey, it's not just about the tissues and stuff like that. I think that is something that I try to do better now that maybe I didn't do as much before, even though I knew about it. If that makes sense. It's like my way to educate about it had, I think, improved and is still going to improve in years to come. And I'm still working on it, like all of us,
That's right.
really.
I mean, because we aren't verbally communicating to patients the same way as we did 2 or 3 years ago, and so it only makes sense that even how your written word is communicated on via social media. So I can relate to that, because I remember first reading some of your posts a few years ago, and you would maybe even hesitantly give up, like, but you should consult a doctor or you should talk to someone, where you're kind of like covering
Yeah.
you're covering your backside there. But now you're just getting into it, like what you just said, layering situations, and helping people understand more of why they're experiencing some of these discomforts or some of these troublings like back pain and that sort of thing. So I can definitely relate to the transformation of your communication. And I think I hate to say it, but the followers like share that interest in how you communicate. So I like to ask this, like, how long does it take for you to create a single post?
If it's a brand new, like everything is brand new, and I'm editing the videos with like text and arrows and making a new cover slide and all that kind of stuff, like for like a carousel post, it's usually anywhere from like, even now, even after doing it for so long, it still takes maybe like an hour and a half, sometimes 2 hours to do that. And that's like, so that's the other thing I wanted to I want to backtrack real quick.
Okay.
So you talked about like starting, people don't know where to start and stuff, and this kind of plays into that. So there's something to be said about like, if you're constantly just trying to like, if you're constantly trying to do all the research about how to make everything perfect, it's like paralysis by analysis kind of thing, that can hinder a lot of people, because they're like, oh, I don't want to like put something that's not good up, or I don't want people to like, other clinicians to look down on me because this isn't like good or whatever. And you're constantly like over analyzing everything, you're not going to get anywhere. So I think there's something to be said about having the confidence to just put something up sometimes, even if it's not the best, is really kind of a good thing, because you have the confidence to actually do it rather than just sitting back forever and being too scared to put something out there. That's number one. But then at the same time, you can't just do that and expect to grow and have a really big following. You need to actually put in the work to do the research. So it's a kind of this balance of like, you need to research, you need to study other people, you need to see what works, you need to kind of immerse yourself in whatever platform you want to grow on, or multiple platforms, but you don't want to do that so much that you never actually do anything. So there's something to be said about both sides of that. So at the very beginning, when I started, I mean, it's kind of rough. Like if you really put your time into this, like it was rough. Like I was getting like 4 hours of sleep like a night. Like this is without a kid or anything. And I was like just grinding, because you can't, if you really want to grow at the beginning, you can't be like constantly reposting other people's stuff. And if you're starting from ground, like zero, either you make a bunch of content at the beginning and then you start posting a lot, so you kind of have stuff to fall back on, or you kind of just do it on the fly. And I made maybe like a couple of weeks worth, and then I was like, oh shoot, I'm running out of stuff. And I just started posting, like every day I'd be editing stuff, and it was taking me like hours because I was still learning this stuff. So you kind of have to grind a little bit at the beginning to build up your content. And you have to make content that you think is shareable even with people in your own field, because the fastest way to grow on social media is for somebody else that has a really big account to go, wow, this guy's good, and share your stuff. No matter like, because you're going to be limited by your following size, how many people know you that are on there, and obviously the bigger size you are, and the more people that are liking your stuff and saving it and sharing it, the more that like I'm quoting in there right now, the algorithm will push it to more people, because it will push it to their friends and people they talk to, and so it's a lot easier to have the train continue to roll. Whereas you start, it's really tough. So to have other accounts share it can be really helpful. But what a lot of people will do is they'll just be like, hey man, can you share my stuff? Like, I really like your stuff. It's like, if I don't know you and you're asking me to do that, and you're like, I don't know who you are, like, why would I share your stuff? So the best way to build the relationships is to like, not in like a fake, like spammy, like, oh, I love your stuff, man, and just constantly post this like same thing on someone's page, like in their comments or their DMs, and just kind of be fake about it, because you can see through that right away. Like people will be like just saying stuff to me, and like, I know the only reason why they're talking to me is because they're like, I want you to look at my page and follow me and share my stuff. Whereas if there's somebody who's genuinely just like, hey, let's talk shop about this thing, or like, I really like your stuff because of this, and they're genuinely do it, maybe in the back of their mind, like, I hope maybe he looks at my page and sees my stuff and shares it, but like, they're not doing it just for that reason. I can respect that. And I'm not like trying to take credit here, but there have been some pages where like, if I've shared their stuff, I know it's given them a boost, and I'm like happy about it, because like, I know this person's a good person. They've been reaching out to me. They're genuine. They want to build a relationship. They're not just doing this to be like, hey man, just share my stuff, you know?
Right, like
So
the intentions matter. You know, if someone is just going to piggyback
yeah,
off of your success to try to get their own, the
yeah,
intentions are malaligned, you know. But if someone wants to form a relationship online with you, like those intentions speak volumes, because there are some genuine people out there that sure would love, you know, secondarily would love for, Caleb Burgess to share their material on their social media accounts, but that's not the primary driver. The primary driver for them, much like it is for me and getting you on this podcast, is, hey, let's form a relationship. We had one back in college, but let's kind of connect professionally here. And by the way, kudos to you, because I like what you're doing. So that's really the primary driver. I also want it to be real, though. I want it to be like authentic. So I wanted to hear how long it takes for you to put a post up, because like I said, most people think they could just take a picture of something and just put it on there and like done. They're good, and I'm no marketer. I'm slowly becoming a little bit more of a marketer. But even something like hashtags and playing with the algorithm, it's a game. I mean, and I see why there are careers and an entire industry dedicated to this sort of thing. So if we're the trade-off for me would be, okay, do I give up clinical hours in order to get an online presence? If I give up clinical hours, well, then that, as a sole practitioner, that means I'm actually taking less home every month. So that's a tough conversation to have with my wife and kids. Like, hey, I made less this month, but I got my followers up to 1,000. How about that?
They're like, so, do I really care about that?
Yeah, at the end of the day, like, does that matter? No, it doesn't matter. So I do want to unpack a little bit more on social media. But I also do want to respect your time. So I think we'll stop us there. And what we'll do is we'll publish this podcast in the next couple of days. And those of you that are listening, please email, send us some messages. And what we'll do for part 2 is we will have Dr. Caleb Burgess back on, and we'll do a Q&A where we'll say, come on onto the episode, ask your question, and we will have Dr. Caleb answer all of your social media questions. And we will post that one as a part 2. How does that sound, Caleb?
That sounds like fun. I have one more thing to say that just
go for it. Go ahead.
The thing you said about consistency, and this is just to kind of keep it real, and you don't have to do this stuff. I'm just going to tell like some of my experiences. The consistency thing, one huge thing, especially on like Instagram, is like the time that you post. So posting at a specific time every day and finding that time is kind of different for everybody in your audience. For me, it happens to be 6 a.m. Pacific time. So like right when I'm waking up, I'm posting, and it just seems to have done well over the years. So the consistency thing, like some people understand the dedication that kind of goes into this. I've been on vacation in like Hawaii, and I literally will wake up at 3 in the morning, 3 in the morning on vacation, post, because you can't automate it for some things, but if you have like multiple videos and stuff, you can't do that. I will post at 3 in the morning, go back to sleep. And I did that like every day of my trips. I went to Hawaii twice. And that's everywhere else in the world. You kind of just have to adjust. But even like, I remember I was in Florence, Italy, and I was in the Ponte Vecchio. I think it's the Ponte Vecchio. That might be the bridge. I don't know. But it's basically like this like historical site there. I was inside, like in a museum, and I was like, hold on, I got to post. And I like went on the city Wi-Fi, and like, you don't have to be like that. You can totally unplug and enjoy your trips. And I totally still did enjoy my trips, but like the dedication that goes into, if you really want it, you just have to kind of be a little bit crazy in a way, but and have that dedication if you really want it to grow and continue to grow. So that's just an example.
No, I appreciate it. See, that's the kind of material that private practice owners, I'm sure, are wondering about in the back of their minds, just like I am. And you're right, it's a commitment. And so, I'm sure we're going to have questions, some follow-up questions. And so I'm excited to have you back on. We'll collect the questions, and then we'll send them over to you, and we'll answer them on part 2. Sound good, Caleb?
Sounds good.
Thanks, man. Appreciate your time.
All right, no problem. We'll talk soon.
That wraps up today's episode with Dr. Caleb Burgess. We want to share our gratitude for him and his willingness to come on today's show. As we discussed on the show, we will be doing a Q&A follow-up to this episode. So if you have any questions that you would like answered, or maybe there was something we didn't discuss on today's show that you would like us to talk about, please email your questions to admin@mwri.co, or simply type into the comment section of our latest Instagram or Facebook post, so we can be sure to ask Dr. Caleb on our next episode. Last but not least, please subscribe to our podcast on Apple, Spotify, Stitcher, or wherever you listen to your podcasts. If you could also leave a 5-star review, that would help us know where we are currently with our guests and content so we can continue to meet your needs moving forward. Thanks. And until next time, this is Dr. Alex Earl.